Well, thank you so much, everyone, for going to the open forum. I just noticed our next speaker, Nakeisha Robinson, is on the phone. Nakeisha, can you hear me?
Yes, I can. Good morning.
Good morning. All right, wonderful. I'm going to take a moment and formally introduce Nakeisha, and then give her access onto as presenter mode. So I'll actually do that right now. Nakeisha, I'm going to give you access right now. Should get a prompt right there. As Nakeisha is accepting that, just to give a brief synopsis of her background, Nakeisha is a community health and social justice advocate who partners with local organizations focused on improving the lives of mothers, families, and babies. She has worked passionately and extensively in LA and surrounding communities around health disparities, negatively impacting women, babies, and families through community residents and direct service provider curriculum development, educational presentations, program implementation, and coalition work. She is a licensed marriage and family therapist and is currently working with the LA County African American Infant and Maternal Mortality Doula Pilot Project as the clinical consultant to address the Black African American infant and maternal mortality crisis through increased access to doulas. So Nakeisha, we can see you and we can hear you, so the floor is all yours. Thank you so much for being here today.
Great, thank you. I appreciate the warm welcome. I am excited to be able to share with you our project and the launching of it, and just kind of discuss some of the details. So we'll just jump right in. So again, my name is Nakeisha Robinson. I am the Doula Clinical Consultant for the LA County Department of Public Health African American Infant and Maternal Mortality Prevention Initiative, the Doula Project, also known as AAIMM. So today, I'm going to just talk a little bit specifically. I'm going to talk in the larger context of the overall AAIMM initiative, but then I will just focus in on specifically the Doula Project, the services that we provide and the support provided, DPH's role, training opportunities, and then the good stuff, which is, client eligibility, how to make referrals, and answering any questions that you may have. So to just kind of kick us off and start off, why are we here? So many of you may or may not just kind of be familiar with the LA County 5-year plan to address and close the Black-white infant gap, infant mortality gap. So here we just kind of first want to start off to just ground us in that when we're looking at data over the past 10 years, there's a couple of areas that we know that we haven't closed the gap in terms of infant mortality, maternal mortality, and preterm birth. So this first slide here just gives you the data looking at a period of time from 2003 to 2017, where you can see here that the Black infant deaths are 2 to 3 times that higher of any other racial group. And even though infant mortality rate has declined for all racial groups, as you can see the progression here over this time, it still remains highest for Black infants. When we look at maternal mortality, we find the same thing. So it's still looking at the data from the same period of time. And when we look at it over the course of a 5-year average, we see that Black maternal deaths are 4 times that higher as any other racial group in Los Angeles County. And these issues are pervasive throughout the country, throughout the state, and so they are being addressed on the national, statewide, and of course the local level. Coming to look at preterm births, which we know is the kind of #1 predictor for infant deaths. When we look just like on the previous infant and maternal mortality slides, you'll see here that, again, the disparity over over more than a 10-year period, the African American preterm birth rate is consistently significantly higher, about 1.5 times higher than any other race. So even when the rate has decreased in previous years for all race and ethnic groups, this disparity for Black infants still persists. The African American rate has never come down enough to align with any of the other populations when we look at the data racially disaggregated. Preterm birth, as I mentioned before, is really the largest determinant of infant mortality. So how this relates to doula work and doula support is that, we know that doula support has demonstrated lowering the risk of preterm birth, which is why it's one of the key strategies of the overall AAIMM initiative. And then an additional note is that California's Perinatal Health, Perinatal Equity Initiative, PEI, as maybe some of you may be familiar with, is also geared at reducing African American preterm birth, which then is related to infant mortality. So as I mentioned before, this is not just a local issue, but this is something that is being looked at and addressed on a national, state, and level as well. So the Doula Project. Whole person care, the funding comes from whole person care. Whole person care is federal funding from the Centers for Medicare and Medicaid Services via the California Department of Health Services. And so whole person care's goal is comprehensive coordinated care for the beneficiaries that will result in better health outcomes. So LA County's Department of Health Services applied to be one of Whole Person Care's pilot sites, looking at offering services for multiple high-risk populations, including perinatal high risk. And that is how the money was able to come to the AAIMM initiative to fund the Doula Project. So in other counties, there are other doula pilot projects that are also launching, like San Francisco Health Department and other areas. So there are other counties that have applied and received PEI or Perinatal Equity Initiative funds, and they actually use those dollars through the PEI funds for doulas. LA County, we were fortunate that we had this option and were accepted to be a whole person care pilot site. So our overall perinatal, our overall PEI initiative and AAIMM initiative is able to kind of use some of those funds for something else, and the doula is an additional bonus to that. We're able to do additional work through the whole person care funding. The goals of the Doula Pilot Project are looking at not only increasing access of doulas to Black and African American birthing individuals and their families, but it also is to increase the workforce of high quality doulas that can provide culturally congruent support to Black and African American families. And our goal is to serve 360 clients. And we plan to do that in a timeline. We launched our program at the end of November, beginning of December, which is when we started accepting referrals. And we plan to go through June 2021. The actual service delivery for clients will kind of go through March of 2021, and then we have the last couple of months to just finish up the services and any postpartum visits, et cetera, that we may have. So what is a doula? A doula is a birth doula is a companion who supports the birthing person during labor and birth. They're also trained to provide continuous one-on-one care, as well as information, physical support, emotional support to birthing persons and their partners. I know many people are familiar with it, but it's important for us to all work off of the same context. as well as to really understand what doulas are not, like what they do not do. So they are not medical professionals. They do not perform any clinical tasks such as vaginal exams, fetal heart monitoring, blood pressure checks. They don't give medical advice or diagnose conditions, make decisions for the clients, medical or otherwise. So that's meaning they don't speak on behalf of the clients regarding what the client would or would not like to do. They don't pressure the birthing person into certain choices just because that's what they prefer. So, you know, the goal is that they leave their own personal bias and personal preferences and desires. They check that at the door. They take over the role. They do not take over the role of the partner, the support person, or family member. In fact, they work collaboratively with them to educate them and help empower them to be able to advocate for, you know, the birthing individual as well as the needs of their family. And they do not touch the baby, and they do not change shifts. So this distinction is a little bit because in traditional doula or private doula work, you may have some that, you know, after a 12-hour, 24-hour period of time, they already have that built into their contracts that they would, you know, bring in a backup doula, or they would need to change. In the roles of the community doulas, that's not typically it. The community doulas typically provide that continuous, ongoing one-on-one support. Although we do have backup doulas, you know, in the event that it does become, you know, an extended labor or there is some type of emergency. So in looking at thinking about why doulas? Why doulas? Why doulas for focus specifically to close the gap on Black infant and maternal mortality? Earlier, I mentioned that LA County created their 5-year plan to close the gap. And as part of that plan, they spent a lot of time doing listening sessions. And it was during these listening sessions through, you know, with community-based organizations, maternity care providers, nurses, people in the community, that they really embraced and understood that as equally as infant mortality, Black infant mortality was an issue, so was the issue being faced in a crisis related to Black maternal mortality. So, you know, we know that Black women experience disproportionately high rates of poor birth outcomes, and it is not for the reasons that you may think, such as lack of prenatal care or the point at which the birthing individual begins prenatal care or chronic medical conditions. In fact, as part of this plan and through this, it really looks at the fact that this deals with the weathering effects of systemic racism. And so when we look at why doulas, we know that access to continuous labor support from a doula is, you know, the evidence really shows that there's a decreased risk of cesarean rates, the use of medications during, you know, for pain relief. It also, the support for doulas also increases the initiation and retention rates of breastfeeding, the satisfaction with the entire birth experience, as well as the chance of spontaneous vaginal support. So when we look at why we want to use doulas, we're looking at this, the data that demonstrates these, you know, the poor birthing outcomes. We're knowing that the facts and the data is also supporting the fact, you know, the issue of weathering and systemic racism. The support for doulas to help educate, you know, decrease the stress of, you know, the birthing individual that they may be experiencing, the anxiety going into the birth. And so we know that doulas, you know, that there is evidence that really just demonstrates that they have impact on decreasing some of these poor birthing outcomes, including preterm births, which again is experienced at, you know, disproportionately higher rate for Black birthing individuals and infants. So let's talk just a little bit about, share with you about our AAIMM doulas. We currently have a cohort of 12 experienced Black and African American doulas. And as part of this project, before we began to really implement it, we have a doula advisory committee. And this committee helped us in terms of understanding, you know, really what were some core things that needed to be a part of the program in general, the number of visits, who was providing the services, what types of trainings would be needed. And this advisory committee is composed of, you know, academia, it is, you know, healthcare providers, mental health professionals, doulas. So it's a large, you know, committee that includes, you know, multiple disciplines. And so, you know, the emphasis on initially as launching this and really trying to have the biggest impact, there was the importance on looking at recruiting experienced Black and African American doulas. So we currently have 12. And when we say experience, we're looking at that all of the doulas had at least 6 or more births. Many of them have well more than 6 births and have been doulas for many years. And the doulas, our doulas really reside all over the county in SPALS 1, 2, 3, 6, and 8. And so here you'll know a slide sharing with you our 12 doulas. We have Bethany Benson, Carla Clark, Felicia Francis Edwards, Jordan Smith, Keisha Smith Spears, Latrice Matthews, Mariam Abdul Kareem, Monique Cowan, Mercedes Johnson, Tamara Robertson, Tanya Michelle, and Sarita Staples. And these doulas make up our cohort of AAIMM doulas. And again, during the month of October, we recruited doulas. We sent out the request for doulas far and wide through all of our networks, including AIM, just all of our professional personal networks, interviewed doulas, and then selected a cohort of them, and they came on at the end of November, and we began seeing clients at early December. So just a little bit around doula support that is provided in what we do. So we have, what we provide is prenatal visits, continuous labor support, and then postpartum visits. And so our prenatal visits, there's 3 prenatal and there's 3 postpartum. And during the prenatal period, we really look at trying to prepare the clients for birth. The doulas are supporting them with, you know, prenatal care, healthy eating, reducing stress. At times, this could also include them attending, you know, the OB appointment with the client as well. We look at especially covering signs of labor with, you know, looking at a population that is at risk, high risk for preterm birth. We want to make sure that we are covering that, the warning signs, stages of labor, the introduction of the birth plan, navigating the medical system and the staff. So really just kind of understanding informed consent. Then we also look at hospital procedures, infant feeding. So when we look at infant feeding, we want to, you know, discuss this with them during the prenatal period so then that they can be prepared, especially as it relates to breastfeeding. So is the plan for breastfeeding? If so, we want to be sure that we line up support around that. I'll talk a little bit more about the training, but the doulas, you know, are there to be able to support that birthing individual with, you know, initiation and retention of breastfeeding, you know, themselves, and making, you know, effective referrals and linkages to resources in the community. And then also just discussing preparing for the newborn. And then what I do want to just also highlight as well is that So we encourage referrals to come in as early as possible. We do not have a gestational requirement. So if a referral comes in, the client is 12 weeks pregnant, we begin right away to just kind of provide that support. But the doulas themselves are available to clients throughout the pregnancy. So they're available for questions and for, providing information, providing support outside of the scheduled visits as well. So whether that be text or calls, so they really just are available to the clients. Then we also go into that they provide the continuous labor and delivery support. So during the last few weeks of pregnancy, they are on call 24/7. And then, on call means they are, available, to that client to support them during that time. And then post-birth, they stay with that client for that golden hour to get that skin to skin. And then if breastfeeding is the feeding choice, to help, to kind of help with that initiation of breastfeeding. And then we go into our postpartum visits, where we have 3 postpartum visits. And that really, again, just includes the infant feeding and if that's breastfeeding, the infant daily care and safety, mom's self-care. So knowing that, there is a higher risk for maternal mortality, just making sure that mom's care is in place, feeding, sleeping routines, bonding activities, connecting to local resources and peer support. So there are local and community resources such as sister circles or breastfeeding supports that are available, and we look to connect them to that. Additionally, clients receive as one of the incentives, they receive a code for an app, Pacify, which then they have for 6 months post-birth, and that is giving them 24/7 access to IBCLC, International Board Certified Lactation Consultant, to just provide that additional support. We also look at supporting them, with seeking and accepting family and friend support. So, when people ask how can they help, just really helping them accept the support and help. Maternal and mental health. So we do screenings as well as, referrals. And so it is our goal on that to make sure that we have warm handoffs on all of our referrals that we're supporting clients with, and then preparing them for discharge. So in the role of the Department of Public Health and looking at kind of like what their role is and how DPH supports the doulas, it is through stipends. So our doulas are paid by being reimbursed for activities that we know enhance and will really kind of have an impact on reducing infants and Black infant and maternal mortality. So our doulas are paid stipends for the actual doula work, which is the prenatal visits, the labor and delivery support, and the postpartum visits. Additionally, they also receive stipends for, participation in trainings that we have determined, and I'll talk a little bit about that in a few minutes, around trainings that we want to make sure that as a baseline, all of our doulas have, and so all of our clients are really able to receive like the same level or quality of care. So they're able to receive, so the time that the doulas spend on this, which goes back to the other component, which is not just increasing the access of doulas for Black birthing individuals and their families, but also increasing the workforce and doing that workforce development. So really honoring the doula's work with livable wage amounts, and we do this through stipends. The doulas also have doula kits, and this just really kind of comes in form of like we have really like a standardized educational materials that we provide to the clients. we have information on, paid family leave, information related to like resources that the clients may or may not need and have access to. So we have the kits that we provide for the doulas. Also, on top of that is just the print materials, like I mentioned before. So just access to just information, resources that can be shared with clients. We also have client incentives, which again, I mentioned one, the, Pacify app. We have other types of things, such as, gift cards, diapers, safety kits for the clients, and things like that. And also, we are, providing support through a media campaign. So First 5 LA is partner with us on this, and they are taking the lead on doing the media campaign. And this includes billboards as well as social media. And this media campaign is really looking at increasing the community's knowledge around doulas. What are doulas? What do doulas do? Why do we need doulas? And what does doulas look like? Or what does this really, which is kind of our effort at the campaign, is it takes a village. And so like, what does this village look like? How do we activate the village? So how is it that doulas work in concert with this village to provide the support to the birthing individuals? And again, this is done through print materials, billboards, social media, which we've already seen, and just kind of has been very effective in terms of like being able to launch the program in terms of for recruiting doulas, as well as recruiting clients and receiving referrals. We also look to have like the peer mentor support and technical assistance. And so that's one of the things is in my role, is being able to provide the peer support and clinical support to the doulas themselves. And we also have training opportunities that we provide. So a little bit around the training opportunities is that, we really want the best outcome, and we really want to make sure that we have the best relationships with hospitals, so that the doula really is seen as part of the team and not an adversary. So we've put these additional trainings in place to support the doulas. And so these types of things, in addition to the trainings that you see here, which is the lactation educator specialist. So all of our doulas, will go through and receive this lactation education specialist training, and that is 45 hours. And some of the doulas have already had this, so some of the doulas will be moving towards the training that moves them forward towards their IBCLC, lactation consultant. We also have trauma-informed care for doulas training, and that's 9 hours broken down into different modules. We have the CPR, first aid training, as well as other additional trainings such as like newborn care, full spectrum doula training, the business and technical assistance piece. So this, looks a little like as doulas in private practice, they have their private practice in the way in which they do their business, but in the role for the AAIMM project, they really are combining some home visitor skills. So the community doula role is different as part of this program and with many programs, in that while we don't spend, that's not what the sole purpose of the visits is, to kind of help them navigate systems and connect them to resources and such. We do want to ensure that the doulas are aware of that. They're aware of resources. They are connecting with clients on additional things that they may need that really might impact their ability to have a healthy pregnancy and delivery and the outcomes following. So we look to provide that kind of technical assistance to support clients. And these trainings, as you can see here, for like the lactation educator, and the trauma-informed care training, these trainings are actually open to community residents. We predominantly try and recruit and reach out through our AAIMM network for these trainings, because the lactation educator is 60 participants, and we have 2 trainings for that throughout this year, as well as for the trauma informed, that we're looking at 80 participants. And then also what's not mentioned here is that when we say the full spectrum doula, we'll have 2 trainings, one that will be in 2020 and another one that is in the beginning of 2021. And this is just a result of feedback from the community around. There's a lot of people that have been like doing this work but haven't received formalized training, because in the traditional trainings, through some of the larger doula training organizations, there's just a lack of feeling comfortable with cultural humility and competency within the trainings. And so you have a lot of people that are interested in this and have been doing the work, but haven't done the formal training. So we have this training component. And then additionally, we support them through the, as I mentioned, the one-on-one debriefing and reflective supervision, which is what I provide for the doulas. And then we have regular team meetings that include case sharing and learning, information and resource sharing as well. So the meat of it, which is like, who's eligible for this, what clients? So clients must self-identify as Black and African American and be pregnant. We currently are accepting clients from SPALs 1, 3, 6, and 8. Medi-Cal eligible clients are the priority, but clients with other insurance is accepted. There's just been such a desire to connect clients to the program, so we have opened it up to also SPALs 2 and 4, but those SPALs, we are only accepting Medi-Cal eligible clients only. Again, there is no gestational requirement, and that is really just kind of it in terms of like how, the eligibility for clients to participate. And how do you make those referrals? We do accept self-referrals, so clients can refer themselves. We also accept them from doulas, agencies, clinics, hospital, organization. Referrals are accepted. And to make this referral, you would contact the program staff, our program coordinator, Michelle Sanders, and her email is listed, or Ariana White, who's our program staff assistant. And the only information that we need, so you can email or you can call us with this information, is the client's name, phone number, zip code, and the estimated due date. And once we receive this information, we will take it from there and contact the client to reach out to them, to get them enrolled, to get a little bit of information, and then we can get them connected to a doula. And so with that, that's it in terms of our program. So at this time, I'm open to if anyone has any questions.
Nakeisha, thank you so much for your presentation. We already have one question, and Nandi, I was anticipating this question. Can clients be dual enrolled in the Welcome Baby program and the doula program? Absolutely, they can be. It is no concern to be enrolled in both. We've asked DTH and we've asked First 5, so they can even be dual enrolled in HFA or PAT or Welcome Baby, regardless of funding source, not an issue.
Yes, and that also includes BIH, Black Infant Health, and Nurse Family Partnership as well.
Great. And then there was a question about eligibility. Can pregnant teens be clients?
So we can accept pregnant teens. We just have to, if you have a pregnant teen, we prefer for you to call and speak with us directly so we can just ensure that we are really able to. Sometimes those cases get a little complex. And so we just want to make sure that we can connect them to a doula that can handle all of those things, and then that's the right fit. If it's not the right fit, then we can kind of maybe perhaps connect them somewhere else, but so we just kind of prefer, if that's the case, that you call us directly.
There was a question about, can we get the, oh, perfect, phone number and contact info again right there on the screen. We will also be sharing this presentation in PDF form after the call, so all of this will be made available to you.
Okay.
Liana, access, I'm seeing a client today that had a doula from this program, so that's great.
Oh, good.
Erica was asking, what is the time frame when the client finished the program? You stated that they have 3 postpartum visits.
Yes, so they have 3 postpartum visits. So typically what we try and do is we try and make sure that the that first postpartum visit is within the first week after birth. Then we look at 2 weeks and then 6 weeks. And so, of course, again, the doula is available outside of those appointments to connect with the client. And if there is a particular need or something like that, then we work to just try and figure that out and get the client the support. But it would go through roughly around 6 weeks postpartum.
Thank you. And another question about, what about moms who are involved with DCFS? Is that an issue?
So, so we, again, that's kind of one of those, case by case things. And so you would just call us and kind of let us know what the situation is. We can definitely provide the doula support. So again, these are community doulas and their primary role is doulas. And so even though they can do some things in terms of the home visitor role, like linking and connecting regarding resources and stuff, that is not their primary role. And so when we look at the times that they're supporting them, it's just like if they need more intensive support, it's not that we can't provide it. We can do that. And then we just have to look at how we can connect them to some more additional support, maybe another home visiting program or something like that. So they definitely are eligible and we can accept them. But that would be, again, one of the things where we would like it if you would just call instead of kind of emailing over, so we could just have an understanding of, what we're looking at and make sure we connect them with the right doula.
Thank you, Nakeisha. Another question, how many clients can each doula have on their caseload?
So each doula carries a minimum caseload of 2 births per month. And so some doulas carry caseloads more than that because they do this more full time. And then there's others that have that do this and they just carry the caseload of 2 births per month.
Perfect. Another question about postpartum visits. When are those scheduled? It sounded like they're scheduled maybe up until 6 months, but the interval, how is it determined? So, we don't pre-schedule them after post-birth. Again, the doula would be with that mom, for a couple of hours after the birth. And so typically what will happen after is she'll call and check in with that mom the day after and just kind of check to see when she gets home. And once mom gets home, then they go ahead and schedule that. And we try and see the mom within that first week of her being home. If she is still in the hospital for some reason, then we would, see her in the hospital and have that check-in. So roughly, in general, it's 1 week post-birth, 2 weeks post-birth, and then 6 weeks postpartum. So that's roughly, 6 weeks is when we finish that last visit out. For the clients. And so it's not a perfect on the dot, but roughly that's just the time frame. And that also coincides just with our efforts in terms of for maternal mental health screenings as well. Thank you. And out of my own curiosity, what is the process if the baby is in the NICU?
So if the baby is in the NICU, which is definitely something that we have experienced, then, it's the goal would just be to kind of try and support mom as best they can. So if that is for instance, one mom she's exclusively pumping. So it's to provide that support so she could pump and she could do her self-care. So in that particular instance, and what happened, the doula really is you know, making more of a frequent, like everyday check-ins and contacts. She's seeing the mom, you know, in person. And so it's just kind of that case by case kind of basis. So it's not necessarily that the doula is providing the support and kind of going to the hospital with mom, you know, to visit the baby in the NICU, but rather the support is going to be focused on that birthing individual and just trying to provide the support. And often that would just include like more frequent check-ins with the moms, even though they may not be having those in-person visits, you know, speaking really daily, like, you know, that's what we've done with one particular case is we're just connecting with mom every day just to check in as things can change rapidly or and just different needs.
Wonderful. We had a great question. Is a doula reporter?
So a doula is not a mandated reporter. However, they do have a moral sense of things. And this is why we like to kind of know if there's instances, if there's like DCF involvement or things like that. It's important for us to kind of know who that team is that's supporting them. So then we can just kind of work collaboratively. But the scope of work for the doula is not a mandated reporter. Although some of our doulas are also like nurses or have other professions, and in that profession, they are mandated reporters. So it just, you know, that just extends to all of everything that they do. I hope I answered your question. If not, feel free to ask again.
Well, Nakeisha, on behalf of all of us, I want to thank you for being available today, for making this wonderful presentation, and all the work and commitment you're putting into this. Really appreciate everyone's questions. They were really thoughtful discussion. So with that, we are actually ready to end our call. I know everyone's got a busy day, so thank you so much, everyone. Thank you, Nakeisha, again, and we'll be sure to share the recording and the notes and PowerPoint from this presentation.
Thank you
so much, everyone. Have a wonderful day.
You too. Bye-bye.